All right, everyone. Hello, my name is Kasia Kines. I'm a CEO and founder of EBV Global Institute, and today is my pleasure to discuss SIBO and EBV. We'll go pretty fast, and I want to make it very simple and kind of SIBO 101 for you, but I really want to cast a big picture of it because I think that's really lacking, especially in functional medicine. And I happen to have a lot of experience with SIBO from previous years. And I don't want you guys to, go through the revolving door, which often happens with SIBO. So we're going to have a couple of things. We're going to walk through the three common issues with the stool changes to watch, four common symptoms of SIBO. There's lots, but I'm just going to simplify like big red flags. Um, We'll talk about what SIBO actually is and isn't, how to test for it appropriately, what to do about it, what choices you have if you have positive testing, the common pitfalls. I'm going to make a list of 6 common pitfalls of working with medical doctors or functional doctors. I'm going to also share with you 2 best resources, experts resources that I trust online so you can further your education. So why are we talking about SIBO in the context of EBV? Uh, Quite a number of people with chronic EBV end up reaching out to me and asking, do I have SIBO? I've read about it. It's a little bit like, about EBV. Do I have EBV? I've read about it. And SIBO can be pretty scary, pretty toxic, can cause a lot of chronic health issues, honestly can cause permeability in your gut. Um, and so can cause toxicity, food allergies. You can be really miserable. And there's just a lot of misinformation. So we'll just get to it. We'll give you a very good picture of it. I'm really excited about this. So let's see. I'm not going to talk so much about how EBV and SIBO are related. They can, they may not. There's a concept in medical literature about of transactivation. So unrelated infections can turn on one another. In this case, SIBO can turn on other infections or like EBV, or EBV can turn on other infections. With SIBO, it's just that would be a completely different training. But let's just say you are investigating SIBO because you are reading something and something's matched and people talk, in social media, and so you want to know. Um, the first of all, what you're looking for, let's talk about the 3 common changes in your stool. Um, People have either loose stool or constipation or alternated constipation and loose stool, and they can't pinpoint what it is. So that is part of SIBO presentation. There is a way in which the bacteria in the small intestine prevent your bile from being reabsorbed and recycled back into the liver and gallbladder. When that happens, because you have SIBO in the small intestine blocking it, changing, deconjugating the bile, then the bile has nowhere else to go. It has to go with gravity, so it's going to go into the colon, and that's pretty irritating to the colon wall, and so it's going to flash as loose stool. So you may watch yourself if those loose stools are more common when you have more fat in the diet, because if you have more fat in the diet, then you need more bile, and then you may have that problem. So this, and also you can have SIBO, or you can have SIBO and methane together, and methane would be constipating. So that also something to watch for. There's many reasons for constipation, so it's a good idea to work with a clinical nutritionist, sorry, to actually go through like a checklist of, possible causes of your constipation. And if nothing fits the bill, then SIBO might be a culprit. Let's talk about 4 common kinds of symptoms that you can expect with SIBO. These are the most common. I mean, there's a laundry list of symptoms you may have, but the most pronounced the most visible are number one, people feel like they're so distended, they feel like they're 6 months pregnant, and they may not even eat anything. um, it's miserable. You have gas, you have abdominal pain, often you have bloating, so the whole intestinal um, organ system is inflamed and really confusing because you can wake up with this and you haven't even opened your mouth and put anything in your gut. So how is that possible? So that would indicate that it might be actually SIBO. What else? Um, let's talk about the worst foods. The healthier the foods, the more fiber they have, the more chances there are that it will be the particular fiber that feeds those bacteria. So this is a common complaint. Like the more healthy food you eat to prevent cancer, to get you to move your bowels, to have healthy fiber, the more distended, bloated, and gassy you are, the more miserable you are. And it just doesn't make sense, right? But it does make sense in the context of SIBO. So I'm going to give you, there's certain fibers that certain constituents that I'm not going to go get into it. This is just SIBO 101. I don't want to overwhelm anyone. You can go to the resources and dive into science and dissect the details. But the worst offending foods will be garlic and garlic family, the whole garlic family, the whole onion family, leeks, apples and pears and melons and watermelons are the worst foods, offending foods. So if you feel like, test yourself, if you feel like you're eating an apple and you feel bloated and gassy and distended later, that probably warrants testing. The entire cabbage family. You want to Google cabbage family because there's a lot of items in this family that you may not even know are cabbage family. Like people don't know that collard greens are cabbage family or kohlrabi. That's not, you probably don't eat that one, but just, kale, broccoli, Brussels sprouts, just Google the entire list and see if you eat those foods, do you feel worse? So this is kind of a hallmark of SIBO. And now let's talk about doing like a simple test at home to kind of get an idea if you do need to do professional testing and clinical testing with a doctor. There is a therapeutic diet called low FODMAP. And these are foods that do not contain those particular constituents that will feed the cibobacterial methane, particularly cibobacteria. These are therapeutically designed, there's studies on it, and it's been very popular. It is a therapeutic diet used in SIBO. However, what I need you to know is this is one of the pitfalls in functional medicine. You get on that diet and you stay on that diet. That is not a long-term solution for SIBO. And if you are stuck on this diet because that's the only thing that decreases your symptoms, then that's not a solution because you will eventually develop certain nutritional deficiencies. That's just a limiting diet. So the purpose of the low FODMAP diet is to navigate your symptoms. You can't starve your SIBO with you can't starve your SIBO with foods alone. There's an exception. We'll talk about that. And so what you're doing is you're decreasing the symptoms so you are more comfortable and you're not feeding them so much on their favorite food. So it's not a solution and it is a short-term application. In my view, any therapeutic diets is a short-term diet as you're fixing the problem and looking for the root cause. Okay, so which brings me to the big question, what is SIBO? Let's talk about that. So, SIBO is a small intestinal bacterial overgrowth. So, the big thing I want you to know is SIBO is not caused by foods, and therefore foods are not a solution. SIBO is not like you're treating it with the doctor, walk away, and it's done. You're going to go through revolving door. The cause of the SIBO is typically motility issues. Okay, motility issue. It's not dietary issue. So, somewhere in the small intestine or in the colon, things are not moving. There may be many different reasons for it. And this is, again, lovely to have, it's lovely to have an experienced clinical nutritionist. I think this is the best profession for support like this, working one-on-one with a licensed nutritionist, because they know all this. So there's a couple of situations where you can develop motility issues. Let's say a horse kicked you in the belly many years ago. Let's say you had a surgery, abdominal surgery somewhere. You had appendix removed. You had, ovaries removed. You had C-section, surgeries, impact in a car accident. Anything when you have impact on the abdominal area, and especially surgeries, the body goes through a natural healing process. And the natural healing process internally with the viscera is adhesions, scarring tissue, adhesions. And the adhesions can be completely random. So there could be adhesion between your ovary and your colon, or your colon and your small intestine. And they're pulling. Sometimes it leads to a little bit of twisting of the small intestine of the colon, and the food may be trapped and it's not moving fast. So then you have blocked food, and the more the food sits in your gut and not moves and doesn't move as it's supposed to, there's specific waves in the peristalsis, waves in the intestinal lining that moves the food, but sometimes it's impaired and sometimes the foods are stuck. You have those adhesions, pulling. It can be messy. And so you have food sitting there too long, and too long means invitation to fermentation. Adhesions have to be broken up, and I'm going to talk about how to pursue that. You have to fix that. Let's see, some people have, if you have chronic constipation and you always have, that may or may not be SIBO, but what you want to pursue is, has any other member in your family had problems with chronic constipation? Because it may not be dietary, it may be mechanical, it may be simply from having too long of a colon. The medical term for it is tortuous or redundant colon. Torturous colon, because it's torture not to move bowels, right? Be constipated. So, grandfathers, grandmothers, aunts, siblings, anybody has that. Some people already know that they have this kind of colon. So it's good to, ask around in your family, extended family, because you're born with that. And so you have to navigate it differently. You have to have enough magnesium to help push that food. And you do want to work with somebody like a clinical nutrition, exactly, to help you through that. But that also is one of the causes of SIBO sometimes, because you have fermentation when you should have the foods moving. Another very big issue is, and you need to look it up in a picture of internal organs to kind of see, your belly is filled with small intestine, and the outside periphery above and around on both sides is colon, and then cecum. So in your right quadrant, low, where in that corner, you have the appendix there. That's the area, more or less. So this is also the area where your small intestine feeds into large intestine. There's a little valve there. And so, as the food in small intestine gets processed and digested, and it's being absorbed through the small intestinal lining to give you the nutrients you need, the remnants, mostly fiber, is going to spill into large intestine. The valve there opens between them, allows it to pass through, and closes. This is the most crucial valve for Sibo. This is something that you need to know how to spell. Ileocecal valve, Ileocecal, I believe it is. Ileocecal valve, the most important valve, because what happens in Sibo is it's impacted. It opens and closes randomly, or it remains open. You can therapeutically retrain it. And I'm going to tell you what kind of therapy you need for that. But that erratic function on my function may cause the colonic bacteria that are fermenters to migrate upstream into small intestine. The small intestine, right next to the large intestines, the ileal part of small intestine, is where you absorb most of the nutrients. And unfortunately, this is where SIBO is. Like, this is the most favorite place for the SIBO because it's the closest to the colon. So if that valve is not working properly, you're going to have migration. And now colon requires fermenting bacteria. We have fiber that is not digestible anywhere else and goes all the way to the colon. It's not processed anywhere else. It's not processed in small intestine. Small intestine absorbs your nutrients. So fiber is supposed to go to the colon, and the colonic bacteria are supposed to ferment it. That's your health. That's the prevention of cancer. That's the energy for the colon. That's feeding your good bacteria, which are essential for your immune system, for your Treg cells, and all that good stuff. And I write about that stuff in the book, EBV Solutions. If you want to take a look, like there's an image of it, so you can kind of wrap your head around it. Now with SIBO, what happens is you have the colonic bacteria that are ready to ferment. Let's say you're trying to process the apple and vitamin C from the apple. There's some fiber there, and it's still in the ileal area of the small intestine. Now you have those bacteria from colon sitting in the small intestine. What do? They ferment. They should not be there, and they should not be fermenting. Wrong location. Colon, not small intestine. And so this is where they're doing their job in the wrong place. And what do you feel? You feel distended, gassy, bloated. Oh my gosh, it's just so uncomfortable. So that ileocecal valve is often a culprit. Sometimes when people have the appendix removed, also the scarring is right there, and it's so close to that valve, it can mess it up. So there's a like a subpopulation in SIBO community with that. And I remember one of our students in our program had that situation. She, after the surgery, she developed SIBO and all that. And I remember she shared in that population, there was a Facebook support group, and she shared the therapy solutions for that and explained that to her community as she was going through it. And she beautifully, healed from that, was living her life. And every single person in that community benefited from that therapy. I'm going to hold that horse, because I'm going to talk about what you need to do. And that is one of the solutions for it. Okay. So moving forward, what do? You do testing. And no, stool test is not not a test for small intestinal bacterial growth. No, none, zero. You can suspect, you still need to test. And so very important. So what you have to do is a 3-hour, that would be the best, the 3 hours lactulose test for SIBO, small intestinal bacterial overgrowth. A very specific test. You have some prep to do. You have to change some supplements, remove some supplements for like 2 weeks, 1 week, 1 day. There's very specific instructions you're going to get. And then in the morning, you basically drink a substrate that feeds the SIBO. And then every 20 minutes or so, you blow the air into the little bags. That's all. You want to be really careful so you have clean readout. And so if you have SIBO, they will munch on that fiber in the substrate, and they're going to produce the gas. That's what you're going to be seeing in the reading. Now, if the test came positive, what you want to know is that if you have methane positive, it means you have Sibo positive, because the Sibo hydrogen producing bacteria are the Sibo bacteria, and hydrogen is necessary for methane. Methane feeds off hydrogen. So even if you feel like the hydrogen is high, but Sibo is kind of low, well, you have to quadruple it because most of this was consumed by methane, so the methane can thrive. Okay, so let's talk about. You really need to work with somebody who is trained in Sibo, because it is art. It is complicated. So, what do you do if you have Sibo? You have a couple of options. So you just need to map it out and works with somebody who follows these options and understands them all. Like really, if they just want to give you one of these and not talking about anything else, they're not familiar with these, walk away. Number one option is medications. There's one medication in particular that is very expensive for Sibo itself. If it's Sibo and methane, that particular medication is not enough. So if you have a doctor that is giving you one prescription, ridiculously expensive, unnecessarily so, and you have methane, that doctor does not really understand Sibo fully, and it's like disaster asking to happen. You're not gonna get the results. So with so it's a good test. Like if you have methane, the doctor should immediately recommend two medications for you. An alternative is herbal protocols, and a lot of licensed nutritionists trained in Sibo do that and do that successfully. It takes longer, like medications are 2 weeks. Herbal protocol is about 2 months. And you have to test before and after, please. So do not let anyone not test. And then there's a third one that, from my experience, I feel it's the fastest, the easiest in a way, and actually statistically most effective. This is this is like statistically about 80% effective. And I can, from my experience when I have my one-on-one clinic, I can say, yeah, that is very effective. And that eventually became the protocol of my choice when I have my one-on-one patients. So elemental diet means that you actually are starving the bacteria. You are just making one particular smoothie. It's one formulation. The palatability is an issue. You can't down it. You have to sip it, and that's all you eat for 2 weeks. So the challenge is more emotional and taste-wise. Can you tolerate the taste again and again and again? You're not cooking, you're just eating that or drinking that. But it is doable, and a lot of people don't have much of a problem with it. And then that is really effective. So another thing you have to do is the motility ileocecal assessment for recovery. So the best therapy for that is visceral manipulation. And visceral manipulation, chiropractors can have training in it, massage therapists can have training in it, and physical therapists do train in that. I would say chiropractors would be your least choice, and massage therapists would be your best choice. There are some massage therapists that have extensive training in it. Barrel Institute is the only place in the States that trains. I know colleagues that train in it extensively. That's all they do. They travel all over the world to train. It is extensive, detailed training. It is a deep dive into all the viscera. So these practitioners, if they are very well skilled and experienced, they literally could close their eyes and use their hands to guide them on everything. It's incredible how much knowledge these people can have. And so you're looking for, you may be on a waiting list for 3 months, and that's worth it. I had some of our students, she was too sick, so her husband would drive her 4 hours, and they would stay in a hotel overnight because they found a fantastic practitioner, very skilled. And that was life-changing, and it's worth it. You are looking for somebody, Barrels Institute has a website where you can find practitioner by zip code. and you can check them out, how much training they have, and you can call them up. You can ask around, ask around naturopathic doctor, functional doctors in the area, massage therapists, acupuncturists. Do you know somebody who does visceral manipulation? Massage therapists, they know of each other. And then ask that person, how often do you work with Sibo? Do you have experience with it? Because not everybody does. So they have to know exactly, what to do with the ileocecal valve. They can regenerate it. They can palpate, tell you, do you have impact somewhere? Do you have, twisted colon or small intestine somewhere? They can really bring a lot of information, and it's non-invasive. You're lying on the massage table. They do their work. And I would take a notebook and take notes, because they may say something you may not understand. You need to jot it down. So when you work with a nutritionist or a skilled licensed practitioner who's familiar with Sibo, they will explain what your notes mean. You don't want to walk in, have the therapy, walk out, have no idea what just happened, even if you feel better. You really want to, like, I want to teach you how to fish rather than give you a fish. You want to understand what's happening in the body. You want to learn. And the last thing that you need is motility support. So whoever you're working with, during the process of healing from Sibo and tackling it and working with a practitioner, they will recommend prokinetics. Prokinetics is a general name for a supplement that supports motility. So we can ensure that the foods are moving while you're working on your ileocecal valve and on your gut motility, and on your Sibo. All right, let's talk about 6 pitfalls expected in work with Sibo. It's just, I don't know what it is, but it happens. Number 1, your doctor will put you on a single medication specifically for Sibo while you also are methane positive. This is going to fail. This is not enough. And so that's the doctor that needs more training in understanding of Sibo. Number 2, your doctor will assume that you have Sibo based on your symptoms and provide a protocol and walk you through their treatment without testing first. That's not the way to go. Please demand the right testing. Please, please, please. You need that test, because you need to retest afterwards to see if it was effective and how much the numbers drop. So that's not a doctor that you can't do that. That's like, no. Number 3, your doctor does the medications and low FODMAP diet, but fails to address the motility issue. There's no conversation about visceral manipulation. There's no conversation of regenerating and testing your ileocecal valve, and there's no support with prokinetics. Some of these are missing in that protocol. There's no conversation about it, how to, this is the root cause. You have to go for that. So that's an indication that a doctor is not really familiar enough with Sibo. And the doctor will put you on low FODMAP diet, because that's expected with Sibo. So here you are stuck with the diet, and what do you do? So as I said, diet does not kill Sibo. The low FODMAP is not going to kill Sibo. It's just going to make you more comfortable. They're going to be a little bit hungry, but they're already there. They have to be eradicated, right? And like I said, elemental diet is a therapeutic diet. That's the only diet specifically designed to, in specific ways, you want to work supervised with somebody licensed clinically to walk you through it, and that will do the trick. And so the last pitfall is huge. The motility and ileocecal valve are not addressed. And so you're gonna get treatment, pay a lot of money for the medication and do well, and then it's gonna come back because the root cause has not been addressed. So yeah, so this is a big picture of Sibo that I've seen over the years. These are the big things that I need you to understand. If you ever have an idea, like, I think I have it, I should test it, these are the conversations you want to have with the doctor, so you will know what to do, what not to do. Let me see if there's anything else I forgot. Yes. I wanted to tell you 2 best online sources of factual information, clinical information from experts. Dr. Seebecker has an amazing resource called Sibo Info. Either siboinfo.net or .com, I don't remember. You just Google it. And then my friend, colleague, Angela Pfeiffer is amazing. She's a functional clinical nutrition, has been in, we studied at Bastyr together. I've watched her. She is Sibo Guru, literally Sibo Guru, Guru. And she exclusively works with Sibo. She has wonderful resources. She is amazing. See, like if you can work one-on-one with her, I have full endorsement. She is my full endorsement. But anyway, these are resources that you want to study. You don't want to go in a revolving door of Google and Google doctors and stuff like that. You just go to those two resources. You're going to know exactly what you need to know. And hopefully today kind of streamline what you need to be aware of. And one more point at the end, I'll say, visceral manipulation can be really healing. Dr. Mullen, when I worked at Hopkins, Dr. Mullen is a gastroenterologist, an integrative one. He's published a lot of books and studies, and way back when, in the past, he was an expert in Sibo, and he published some studies on that. And so he invited me to Hopkins, and we worked together for a few years. And so he had a lot of Sibo patients. So I learned so much from him. And the visceral manipulation is what he taught me, and that was years ago, 2008 or so a long time ago, when at that point you had to get the breath test from, you had to walk into the gastroenterologist's office and get it on site. Right now we have them online. You can get a test online. There are consumer direct tests online. You can get it through clinicians as well. So you can get your test for breath test. That's not a problem. And so since I learned about visceral manipulation, I can't tell you how many patients I was able to help over the years with all kinds of issues, just providing that option, get that visceral manipulation, get things sorted out. Sometimes there's twisted organs, literally. I mean, this is just amazing therapy, just a heads up. And it's very relaxing. You can have impinged vagus nerve, and so you're more anxious, and people literally sometimes fall asleep on that massage table first time, not anxious. It's like, what just happened? So encourage you, if you have Sibo, to find somebody, and if you have to drive, it's worth it. If you have to be on a waiting list, it's worth it. We are actually creating a database of amazing visceral manipulation therapists for my community of our students. If somebody has good feedback, we add it to the list because it's really hard to find them. And they are really helpful if you have an opportunity to get one. So with that, if you find it helpful, subscribe, give us thumbs up here in YouTube channel, and I will see you on the next training.